And I think many neurologists know very little about it. I was speaking with my doctor, who's again at Johns Hopkins. She runs the Diet and Epilepsy Center, um, but she discovered it because somebody gave her a ticket to a concert, which happened to be a benefit for for a ketogenic diet foundation, and so she had been through medical school, been through her specialty training in neurology, and knew nothing about it until someone came to her and you know recruited her really to participate in this center. So I think you're right. I think many doctors don't know about it and don't know to recommend it. And I don't fault them for that, but there has to be a way that this can become more mainstream. I am taking medication still, and I'm on Vimpat actually. So a year ago, when I had a seizure and then a second one a month later, saw my doctor again and switched medications. But again, I'm not against medication. I think, sort of my approach is let's throw everything at this that we can. And if this way of eating is the best way to take care of my brain, which I very much believe that it is, then I'm going to do that as well. It would be nice to not have to take medication, but I'm not quite there yet where I feel confident enough and really ready to take on that challenge. The driving thing is a big part of it. If I lived in New York City or somewhere that I didn't even have a car, I might be more eager to get off of medication. But again, I think each person has to make that decision for themselves, of course. And for me, at this point in my life, it's everything but the kitchen sink. It's sort of the approach. The Johns Hopkins experience has been wonderful, I have to say. They're a great hospital, a very patient-centered approach. As a matter of fact, I've heard that they use Disney to train their people, their receptionists and everything. So they're very welcoming, very warm. My first appointment with the neurologist there was an hour. I mean, it's so rare in sort of, our pharmaceutical driven world, you sort of, the prescription pad doctor where you come in and they spend 7 minutes with you and give you a prescription, send you on your way. It's, so it was just a really positive experience, really, talking to and getting to know the doctor. I remember specifically when I walked in and my doctor, Dr. Mackenzie Cervenka, is the doctor there that I work with. And she had her white lab coat and she had a button here from, Society of whatever. And then a pin over here that was 2 pieces of bacon. And I said, "Wait, is that bacon?" She said, "Oh, we love bacon around here." And I said, "Yes, this is where I want to be," And so that was really the first experience. Like I said, they do a pretty thorough job of educating the patients in a when they do an intake, they do it as a group. So there was a group of, I think, 5 of us patients who were starting. And then there's follow-ups every 3 months for, I think it's 3 months for a year, and then every 6 months after that. So that's the stage where I am doing follow-ups every 6 months. And again, each appointment is with both the neurologist and the dietitian. So they can also track what vitamins I'm taking and questions that I'm having or challenges that I'm having with the diet. So it's great support in that way. They've been terrific. it's hard to disaggregate when you're using both diet and medication, and which is helping more, which is doing what. I will say that as far as overall health, my blood markers have all improved. My HDL has improved, my triglycerides, my LDL did go up, but my doctor is less concerned about that, since it's, it's sort of a, the formula of heart health, sort of takes a number of different factors into play. But that's something I'm keeping an eye on. So, and I've lost weight, and, I feel good, and I don't have, the afternoon slump that I used to get, where I'd want to take a quick nap or have a snack or something in the middle of the day. My appetite has regulated, where, my breakfast today was a cup of coffee, and I'll probably eat my first meal at lunch, as I generally do. So it's definitely had benefits across the board for my overall health. And I've definitely found cognitively as well, people in meetings can't believe, I can't believe you remembered that. That was from a meeting, a year ago that we talked about that. And I feel like I've got this little, jump start on everybody else at work, because I'm just thinking quicker in a certain way. I attribute all of that to the diet, for sure. And so even, seizure freedom aside, I would continue doing this, even if I found that it wasn't effective for my seizures. But I do think that it's hard to describe. I feel like I'm on firmer footing when I'm in that level of ketosis. And my ketosis is generally around a 1.0. I measure once a week, more or less, a couple of times a week generally, with a blood ketone meter. So 1.0 milligrams per deciliter, whatever it is, which is, again, I talked to my neurologist about it, and she said, yeah, that's about what we look for with the Modified Atkins Diet. And that seems to be a level that is sustainable without being an undue burden on my time and my life, and effective as far as many of the benefits of the diet.